Good afternoon, everyone, and thank you for joining us. I would like to welcome you to today's learning event titled Introduction to the Maryland Primary Care Program, MDPCP, for Practices, Office Hours. My name is Blake DeVillers, and I will be moderating today's learning event. Before we get started, I'd like to point out a few tips so we can have a successful event. First, since we are recording this event, all attendee phone lines have been placed in a listen-only mode. This event is being recorded and will be made available for future distribution. Second, you are encouraged to submit any questions you might have into the questions box, which will shortly appear on your screen to the right of the main viewing screen. For this event, we will be addressing your questions by topic. The topic agenda can be found in the MDPCP topics box below the current chat window. I will announce each topic in advance, and please be patient. We will do our best to answer all your questions. If there are duplicate questions, we reserve the right to skip over them. All questions will be compiled into an FAQ document upon the completion of this event and will be made publicly available in the fall. You may also email your questions to marylandmodel@cms.hhs.gov following this event. If you have any technical questions or issues during this event, please submit a question in the chat box that will be appearing shortly. Colleen Halverson is our producer for today's event, and she will be happy to assist you. Please keep in mind that any icons such as hand raise or applause have been disabled. Please be aware that multiple people may be typing at the same time in the chat box, and private chats with individuals are also disabled. Okay, let's get started. Colleen, could you pull over the questions box? And as she's doing that, I'm going to welcome our first presenter. Starting the discussion today will be Christa Speicher.
Great, thank you, Blake. Good afternoon. My name is Christa Speicher. I'm on the Maryland team here at CMMI. We have a few people in the room today to help answer and assist answering questions, including Bonnie Gawanter, who's the Learning System Lead for Maryland, Adrian Wiley, Kate Sapra, Rebecca Van Amberg, Howard Haft, and his team are here from the state as well. So we're really excited. We really hope we can answer as many questions as possible today. Please be patient with us as some of our policy is still evolving, and so really, we'll do our best to answer questions, and we continue to ask that folks will submit through the mailbox, and we're working on getting those questions answered as quickly as possible. I did want to first, I'm going to go through and answer some of the questions that were submitted in advance of the office hours. So thank you to those folks who sent those in. That's very helpful for us so we can make sure we get you a very thorough answer. So I'm going to go ahead and get started with the submitted questions. One of the first questions that we received in advance of the webinar today was around reporting requirements. We had questions about how the CTO financial reporting will look and what the CTO must report versus the practice. And I'm going to just say quickly that CMS is planning to release the financial reporting guidance for CTOs and practices in the Getting Started with MDPCP guide. That guide will be available as close to the launch of the model, January 1, 2019, as possible. We recognize that there's a lot of information that practices and CTOs are looking for around the reporting, and we will be releasing that in the MDPCP guide. For the care transformation requirement reporting for practices, this is very similar to the CPC Plus reporting. So if you have access to the CPC Plus implementation guide, that is a good resource for seeing what the reporting looks like for practices, but understanding that the CTO reporting will look a little different. So that was the first question around reporting. The next question that we had that was submitted was around application submissions. And I know there's probably folks on the line listening in who have submitted questions to Remedy around the applications and submitting multiple locations under the same username. We are working as we speak on a fix to this in our system. We understand that this is a challenge because there will be multiple applications that folks will need to submit if there's several practices. So we intend to fix this hopefully within the week. So my suggestion is to go in the beginning of next week to the system and check to see if that fix has been made, and we will possibly be able to send something out if we know in the next week that that's been completed, so folks will know to go in and that it's ready. So thank you for your patience around that. If there's questions around submitting applications, please send those to the mailbox, and we will answer those as quickly as possible. Additionally, the system only allows for one user per application. So, you know, everyone can sit around the computer and try to answer the questions, but there really is one user per application. So you can't have one application with multiple users. So those were the questions that we had submitted around applications. Again, thank you for your patience around that. For those groups intending to submit multiple applications, we are working on that diligently. The next question that we had submitted was how can we find out our CMS fees based on HCC? So all of the CM practices will be notified, selected practices will be notified of their CMS as close to January 1 as possible. That will be available in the provider portal. Again, that is something that we will get out to practices as soon as possible, but shooting for as close to January 1 as possible on that. We also had a couple questions submitted around can a practice utilize a care management staffing vendor, not through a CTO, to provide dedicated care management resources? So care management fees must be used to meet the care transformation requirements, and practices must account for how the CMS is spent. CMS, we are not prescribing specific staffing models. So at this time, you know, we're not dictating how practices, well, staffing is to be designed. So I hope that answers some of the question. If there's further questions around that, please feel free to submit to the mailbox. We are not prescribing that at this time. Another topic that we've received a lot of questions on and kind of put into one question is around telehealth. So there's questions around embedding telehealth as an option for behavioral health and the different tracks. So I'm going to just make a couple of statements about telehealth and expect more guidance to come out around this in the coming months and in the guide. But under MDPCP, telehealth should continue to be billed per Medicare guidelines and regulations. There are no changes to telehealth billing under MDPCP, so you should continue to bill Medicare telehealth. There are no telehealth waivers under MDPCP, although this may change in the future around originating site. So keep that in mind, that how that applies in Medicare is how it applies under MDPCP. We're trying to keep this as simple as possible, but understanding the need for telehealth. So we're considering an option for embedded behavioral health and can be used to satisfy co-location requirements under the care transformation requirements in MDPCP. The CMS can be used to hire a behavioral health staff person, and it can also be used, the CMS can be used for funding telehealth related activities. Again, the intent of the CMS is to meet the care transformation requirements, used to be meeting the care transformation requirements. So another question that we get a lot of is the behavioral health menu of options. That will be outlined in the Getting Started with MDPCP guide, but that again will be very similar to CPC Plus their menu of options, so please refer to that in the meanwhile, but we will be putting that out in the guide as well. Another question, I think someone, there was some, I don't know if it was in a webinar last week, someone had a question about, can you clarify the statement that behavioral health can't be billed? If a behavioral health provider co-locates under Track 2, can't that provider bill for therapeutic services provided? And the answer is yes. So I wanted to get that answer out to that person who submitted that as well. So that's all around the behavioral health, telehealth piece. Again, further questions submitted to the mailbox, and we will be doing work with around telehealth and behavioral health as part of the learning system. So look for that in the once the model is launched, and we will be providing further guidance around that as well. So those were, oh, actually, I'm sorry, I had a couple more questions around QPP and MACRA. So we continue to receive multiple questions around QPP and MACRA. We fortunately now have an MDPCP specific QPP set of FAQs. At the end of the presentation, there's a link. It is located on the state's website. That is the most current and up-to-date policy around QPP as it relates to MDPCP. So I would really encourage folks to go take a look at that, print it out, read it. If you still have questions, submit them to the mailbox. We, you know, we've vetted this through our internal group here, and we think that this is the best way. This is the most current information around QPP. So please take a look at that. The other option is to submit questions around QPP to the QPP mailbox here at CMMI as well. Okay, so those were all of the submitted questions. Blake, I can turn it over to you to go on to the next topic area at this point.
Great, thank you, Christa. Just a reminder to all of our listeners and attendees, we are going through questions based on topic. So please take a look at the MDPCP topics box in the bottom right of your screen. We've already covered submitted questions, and we're moving on to anything to deal with the MDPCP overview, dates, and deadlines. I do see that a few people have been entering questions already into the chat box, but they seem to be more specific to CTOs, and we'll get to them as we get to that section, okay? So for now, I think that our first question that deals with the overview area of MDPCP is, in terms of the getting started with the MDPCP guide, are you expecting it to be released at approximately the same time as the 2019 CPC Plus National Guide release?
We'll be releasing the guide as close to January 1 as possible, the launch of the MDPCP model. I'm not quite sure when the CPC Plus guide is going out, but we'll be releasing that in or around January, the launch of the model.
Okay, great. Thank you. I don't see any other immediate overview questions. I think I'll answer a couple of the questions that we had that came in a little bit ad hoc, if nobody minds that. We do have a question here that came in prior to the start of the webinar, which is, how is the vendor list to be used? Is there an option for the practices to select a CTO or vendor or both?
I'm not sure what vendor list the participant's referring to. Can you provide more clarification around what vendor list this is?
That question came from Dorothy Lopez. So Dorothy, if you could type into the question box just a little more clarification around your vendor list question, we would appreciate it. And we'll give you a moment to do that. While we're waiting for Dorothy's response, we have another question that came in ad hoc. And it is, for purposes of beneficiary attribution, does the provider taxonomy code need to be primary care?
I think it would be useful probably to take a look at the RFA. We have all of the codes listed out in the RFA.
Great. Thank you, Christa. It looks like Dorothy is taking a clarification. So we'll just give her a moment there. So the clarification from Dorothy is a vendor list is on the MDPCP website and lists available vendor services. And just to remind you of Dorothy's question, it is, how is the vendor list to be used? Is there an option for the practices to select a CTO or a vendor or both?
So I'm looking to my state partners here in the room, Howard Haft. I don't know, Howard, if you can speak to that.
Certainly. So the vendor list was developed to assist the CTOs in finding vendors that might find specific areas of expertise, as in behavioral health or other kinds of services for their utility. There's no prohibition, since that's public information, for individuals contacting those vendors, but they are not initially designed as vendors who would provide support services to individual practices. They were defined as vendors who would provide support services to care transformation organizations. But again, the comment is that there's no prohibition against practices reaching out to any individual who can help them with the meeting the care transformation organizations under the direct supervision of the physician or the provider and providing those services that meet the care transformation services. The list is also, we want to give this disclaimer that that list of vendors is a self-reported list. Their services are self-reported, as are the CTO services, and that's self-reported.
Thank you, Howard. We have an additional question regarding vendor, it seems, and it is, we heard from the state that practices could not hire a vendor to do care management. The care manager had to be an employee unless the practice was using a CTO. Can you please confirm?
So I think that is not a restriction, that the practices can engage those services in the way that they see fit. Again, as long as the care management fees are utilized to meet the care transformation requirements, there's no specific restriction. I would, as a comment put in, though, there is really no intention to make this a arrangement where care management services are exclusively phoned in to clientele. It's to meet specifically the care transformation requirements, which exceed simple telephonic communication.
Thank you again, Howard. And we have one final question that came in a little ad hoc, which I'm going to address now before we move on to our next topic. And for those participants in the webinar here, the next topic coming up is going to be about the online application. So think about your questions and please start placing them into the chat box. But the next question that we're going to address from an ad hoc perspective was, if my practice elects to utilize the services of a CTO, what would be considered appropriate use of my practice's portion of the care management fee? The CPC Plus program guidances highlights the use of CMS to cover care management services, screening tools, etc., that are provided by CTO in MDPCP. So we are having trouble understanding what we can appropriately use CMF for.
Thank you for this question. I think it's, we want to highlight that the practices are meeting the care transformation requirements. The practices are required to show that they can meet the care transformation requirements with the assistance of a CTO. So I think the CMS is used to cover meeting the care transformation requirements. So I don't know if that helps answer the question. If there's still more question, you can submit another question into the chat box.
Okay, thank you. I think that question you just answered came from Christian Gomez. And it looks like Christian's responding right now. So we'll give him a moment before we move on to our next topic. Christian says, so we can use CMS to cover anything that meets care transformation requirements?
Yes.
Yes.
Yes. Okay, great. Thank you for that. All right, everybody, we're going to move on to our next topic now, which is the online application. If anybody has any questions specific to the application, please start typing them now into the questions chat box. And it looks like we have a few people typing, so please stand by, MDPCP team. All right, our first question here is, can you please provide more information on the clinical leadership letter?
Yes, the clinical leadership letter is a letter from the whoever the clinical leader is for that particular practice site, indicating that they will be supportive of the program and encouraging to meet all the care transformation all the care transformation requirements of the program. A simple letter, there's no standard form for it, just acknowledging that the clinical leadership is aligned with the program.
Okay, thank you again. It looks like we have a statement here from Melanie Robin, who says that she went to the RFA and doesn't see a list of taxonomy codes.
Okay, hang on, we're pulling up. So primary care practitioners with a primary specialty code of general practice, 01, family medicine, 08, internal medicine, 11, obstetrics and gynecology, 16, pediatric medicine, 37, geriatric medicine, 38, nurse practitioner, 50, clinical nurse specialist, 89, psychiatrist, 26, and physician, 97 are eligible. However, specialists with these primary specialty codes are not eligible to participate in the MDPCP and should not be included on an applicant practitioner roster.
Okay, thank you. And Melanie also thanks you in the chat box.
No problem.
Do you have any more questions right now on the online application? It looks like a few people might still be typing, so MDPCP folks, please stand by. And just for anybody's awareness, Christa, is there a place where those codes are listed other than the RFA?
Not at this time. If you submit the question to the mailbox, we're happy to provide those as well. But
okay. All right, thank you. The next question we have is, oh, I'm so sorry, hold on one moment. There we go. Does the letter have to be detailed as to how the RFA outlines it, or just be simple as how you just mentioned it, I believe? And that is the letter of clinical support.
The letter doesn't need to be formatted, only a general letter from the clinical leader signed by that leaders indicating their support of the program.
Thank you. Our next question that we have is, would you please repeat the taxonomy codes and where they can be viewed?
It's page 5 of the RFA. We can try to cut and paste into the webinar chat box possibly. If you hang on just a moment, I can pull it from the RFA.
And they're also on, if you look at the FAQs on the Maryland state website, it's posted there. also.
I'm pulling up
Great,
the
thank
RFA
you.
to the text chat box now.
Okay, and while that's coming in, we have another question for the team on the online application. Question number 19 on the actual application, the meaningful use reference is referring to the ACI portion of the MIPS.
Yes, so we understand that there's portions of the RFA that are now outdated, and this is we're particularly interested in what level of recognition the individuals are in currently or have been in the past. But this is not an exclusion factor because we understand that it's moved from meaningful use to MIPS now.
Okay, thank you. And our next question that we have is, should we use the practice legal name or DBA name on the application, keeping in mind that there could be more than one practice name, for example, in the DBA under a single tax ID?
Yes, it should be the DBA, doing business as.
Okay, thank you. And as you can see, Colleen Halverson, our producer and technical assistant, has posted those codes for everybody in the name questions box. Does anybody else on the line currently have questions for the online application? So please type them into the questions box. And if not, we'll move on to our next topic, which is payments to practices. So if anybody has questions on payments to practices, please start posting them now. We do have an additional question that just came in, team, which is, how do you define a satellite office?
So in the RFA, we define a satellite office as a separate office that acts purely as a geographic extension of a single practice site. The satellite shares management, resources, EHR, clinicians, and attributed beneficiaries with the main practice location. Practices that are part of the same medical group or health system, even if they share some clinicians or staff, are generally not considered satellites of one practice site.
Great, thank you. And to our attendees, if you have questions on payments to practices, please start typing your questions now into the questions chat box. We'll give you a few minutes here, and if nobody has any questions, we'll move on to our next topic. It does look like a couple of questions are coming in. MDPCP model team, your next question around payments is, how are payments attributed?
I think it would be helpful if you could provide a little bit more clarification around exactly what you mean by attributed.
And I believe this question came from Kashana Edmondson. Kashana, if you could just type into the questions box what you mean by attributed. And it does look like Kashana is responding. So MDPCP team, please stand by. Kashana is asking about attribution or attribute in terms of how will it be distributed. So the question again is, how are payments really distributed, I believe?
Payments are made to the practices based on the attribution of their fee-for-service Medicare beneficiaries to the practice. The care management fees are based both on the attribution of patients and their HCC scores, since it's a risk-adjusted payment. The per beneficiary incentive payments are based on the beneficiaries, not risk-adjusted, but on the beneficiaries. And then adjustments to the comprehensive primary care payments are made based on historical payments of E&M codes that are specified in the RFA. But it's all based on the attribution of patients to that particular practice.
Thank you. Our next question here for you looks like it's going back to the application as a question. And it is for question number 29. Can we select 2 answers if we utilize external resources and also employ resources?
Like we are researching the question.
Okay, thank you. And I do see quite a few people typing, so there might be some additional questions coming your way.
Okay, so I don't think the system allows for you to choose 2, so I would choose the best answer that fits the majority of the, or answer the question most accurately.
Okay, thank you. We have an additional question here for you coming through. What specifically is meant by expanded access for the practices? Is there a set number of hours?
So I think this will be more outlined in the Getting Started with MDPCP guide, but I think expanded access can mean several things, and Howard, please jump in. But we're not prescribing a set number of hours here. I think it's just expanded more than the regular 8-hour office day.
So I think that's exactly right. It's expanded to meet the needs of the patients that are being served, and sometimes it's expanded simply in the number of hours or the days of the week, and sometimes it's an expansion through other means of access to care, and it can be easily monitored by seeing how many appointments are open in subsequent days, which allows kind of a general measure of accessibility.
Okay, thank you. We have another question for you, which is, how often is the adjusted historical PVPM for CPCP calculated, quarterly or annually?
That's calculated annually.
Okay, thank you. And our next question, can you please clarify which payments will be received through Part B payments and how non-Part B payments will be issued or received?
Okay, so the CMS and the PBIP and the CPCP are all non-claims-based payments. They will be paid by CMS to the practice. When practices are selected for participation in MDPCP, we will be sending out information to collect banking information from each practice. Practices should complete that banking information completely, accurately, and as soon as possible and return it back to CMS to ensure those non-claims-based payments are made in a timely fashion.
Great, thank you. I don't see any additional questions coming through yet. We'll just give everyone a moment. If you have any further questions on payment to practices, please continue typing into the questions chat box. And it looks like we have another one, a follow-on to the question you just had. Is the information you just stated found in written documentation?
We will be providing additional information on the financial methodology in the fall.
Okay, thank you. And attendees, do you have any further questions on payment to practices? If not, we're going to move on to the next topic, and that is partnerships with CTOs. Once again, attendees, if you have any questions regarding partnering with CTOs, please begin typing them into the questions box. MDPCP team, I'm not seeing any questions coming forward for the partnerships with CTOs. Attendees, if you think of a question later, please continue to type that in, and we'll make sure that we go back and pick it up for you. The next topic that we have is actually on the learning system itself. And if anybody has any questions on either partnering with CTOs or the learning system, please type that into the questions box now. So we do have a question for learning systems, which is, what is the learning system that you are referring to?
So thank you for the question. The learning system is going to be there as a support for practices and CTOs. We will have a number of events throughout the year. There will be some events that will be for all of the participants and some that will be for specific tracks and areas that practices will be working on throughout the year. We'll be gathering feedback from the practices to find out what you're most interested in working on, where you are in terms of practice transformation, so that we can gear those learning events specifically to your needs as much as possible. In addition to that, there will be some one-to-one coaching that's available, and there will also be some durable products. At the launch of the model, there will be a calendar of events that will be available.
Great, thank you. We have another question here for you on learning systems. Use of the learning system will be available to practices and CTOs. Are there specific requirements?
So the learning system will be available to practices and CTOs. It will vary depending on the event. Some events will be open to everyone, and some will be specifically geared to one group. There aren't in general requirements to attend specific learning events. However, you'll see which events are geared towards things that are most interesting to you, and you'll be able to participate that way.
And just to add, I think we see the learning system as supporting practices and meeting the care transformation requirements. Mm-hmm. So in terms of requirements, there are the care transformation requirements that the learning system can assist with providing information and feedback on related to the care transformation requirements.
I think it's worthwhile to point out that this is a very valuable tool for this program, and it's provided free of charge to the practice.
Great, thank you. We have another question. Looks like a request for repeat of some information from earlier. Could you please repeat the earlier comments related to use of telehealth and CMS regulations, and also the use of behavioral health telehealth? We are unable to hear part of the answer the first time. Okay. They also would like to know whether practices can bill for behavioral health services required.
So just to be clear, and just to reiterate what we discussed earlier, under the MDPCP, telehealth should continue to be billed per Medicare regulations and guidelines. So there is no change to how that is done currently under the Maryland Primary Care Program. There are no telehealth waivers, and although there may be changes to some of that in the future, currently there are no telehealth waivers. I'm just trying to see if there were specific questions. I can just kind of go through what I mentioned before. We consider telehealth to be an option for embedded behavioral health, and this can be used to satisfy the co-location requirement under the Maryland Primary Care Transformation requirements. The CMS can be used to hire behavioral health staff persons. Also, the behavioral health menu of options will be in the Getting Started with MDPCP guide, and it's very similar to the behavioral health options menu under CPC+.
Great, thank you. And just as a reminder to our attendees, this is being recorded, so if you are having any difficulty with hearing any of the answers, the recording should be very clear, and hopefully you can re-listen and gather the additional information if you didn't catch it the first time on this event. At this time, do attendees have any further questions on the learning system or on the payments to practices or partnerships with CTOs? It does look
And
like we have a couple of people typing.
I just wanted to clarify the end of Jennifer's question, whether practices can bill for behavioral health services required. Yes, practices can bill for those services. Just wanted to answer that question. Thanks.
Great, thank you. And I'm not seeing any additional questions coming through for these topics. Oh, I spoke too soon. We have an additional question from Melanie. It is for track 2, enact collaborative care agreements. If we do that with a psychiatry practice, can they also bill for the collaborative care codes?
Can you clarify who they is, and can they also bill? Do you mean the psychiatry? Oh, there it is.
They meaning the psychiatry practice.
I think we'll have to get back to Melanie on that one. I'm not familiar with collaborative care codes. I'm looking to other folks in the room if they have familiarity with collaborative care codes, or Melanie, if you could provide, I'm sorry, for clarification.
Melanie says they are psych-specific codes and is asking that you please follow up.
So I think we'll have to take a careful look at what the collaborative care codes impact would have on the program. To be specific, we'll have to get back to you on that question.
Okay, thank you. People on the phone and attending, if you have any additional questions at this time, please feel free to type them into the questions box. We're just going to, I think, take some ad hoc questions if there's anything that we did not cover yet, or if you have questions on resources that are available to you, if you could please type those questions now into the chat box. Okay, MDPCP team, I'm not showing any additional questions at this time. I'm going to give everyone a few more minutes. It does look like somebody is typing, so we'll give them a moment. And Melanie, who had the question about the collaborative care codes, has a follow-up asking if she should follow up with somebody specific on those collaborative care codes.
Yeah, thanks, Melanie. Are you referring to the Psychiatric Collaborative Care Management, COCM codes?
Yes, it looks like she is.
Yes, so we were just doing a little research, and yes, they can continue to be billed. Thanks for your patience.
Okay, thank you. I do show a few additional people typing. We'll give them a few moments. And once again, attendees, please feel free to type any questions you might have that we have not covered so far today. Even questions about available resources, anything that you might need an answer to. Just an FYI for our model team, Tashana Edmondson says she's looking forward to the MDPCP guide as an available resource I would take.
And I would just note on that as pieces of that are developed, we may be pushing some of those out to share in advance. So we hope that nothing will be a total surprise when you see the guide. So look for those materials to come out. Hopefully some of them will come out before January 1, but the whole entire guide will be out by the launch of the model. So thank you.
Great, thank you. And I do see that multiple people are typing. We're going to give them a few moments as well as for the system to catch up. Once again, attendees, if you have any additional questions, please type them into the questions box now. And we have one more here. Is it safe to assume that the program allows time for ramp-up of resources by both practices and CTOs the first year? The time frame between acceptance and knowing the number of practices accepted is short.
Yes, certainly there will be a ramp-up time. There are a number of significant milestones that are met all along the way in the program. Some of them are fairly prescriptive, some of them are general. There is an anticipation that all practices will by the end of the third year, achieve Track 2 level status. But other than that specific milestone, it's just assuring the practices are, in fact, moving along and advancing in terms of their ability to provide advanced primary care.
Okay, thank you. We still have some time left, everyone, so if you have any additional questions, please feel free to type them now into the questions box. They can be on any subject. If you have anything that you feel we haven't answered, or if you need to hear an answer again, please let us know. And I do see a few people typing. We'll see if anything else comes through. Oh, here you go. The next question you have is, can a practice have more than one satellite site?
Yes.
Okay, thank you. And we have another question. Will you be sending these questions and answers to us after the call? As stated before, after the completion of this event, the MDPCP team will be compiling an FAQ document that I believe will be ready in the fall. Is that correct, Christa?
That is correct. And just to reiterate that the state also has a set of FAQs that are up on their website. If there are specific questions, please submit them to the mailbox as well, if there are questions that you might have missed. We hope to get all of these questions into a larger document to share, hopefully late summer, but the latest fall, that will be on our website.
Great, thank you for that. And I'm not seeing any additional questions at this time. Christa, would you like to say anything in closing?
Nope, I appreciate everyone's questions today and hope that we answered them to the best of our ability, and I think we are happy to continue to answer questions, and I know that the state has a series of webinars that they're doing and would like to be able to continue to provide resources to you as they're available, so continue to check the state's website as well as the CMMI website. And again, thank you for your patience as we work to launch the model.
Thank you, Christa. All right, with that, everybody, I would like to thank everyone for once again participating in today's learning event. A special thank you to our speakers for being here today and sharing their insight and experience. Before closing this event, I would like to draw your attention to the office hours survey link, which is going to be appearing in your screen shortly. Please click this, the link in this box and select Browse To in order to access our brief feedback survey. We'd greatly appreciate it if everyone would take a minute or two to provide us with their feedback pertaining to today's learning event. All feedback is confidential and will be used to improve future learning events. We also encourage you to visit the model webpage to explore key resources. We'll be pulling over the resources pod if you would like additional information. With that, I would like to formally close today's webinar. I hope everyone has a fantastic afternoon, and thank you for attending.